Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. May is National Mental Health Awareness Month. Each year, millions of Americans face the reality of living with a mental health condition. 1 in 5 adults will experience a mental health condition in their lifetime. However, everyone is affected or impacted by mental illness through family and friends. Our goal today is to spread awareness and highlight organizations that's goal is to ensure that no one is alone on their mental health journey. My first guest is Martina Gollin-Graves. She's the president and CEO of Mental Health America of Wisconsin. Hi, Martina.
Hi, Andrea.
Thank you for being here. And Mental Health America of Wisconsin's work, you're pretty much driven by your commitment to promote mental health as a critical part of overall wellness. So if you would tell us more about the organization and your mission.
Yes. So Mental Health America of Wisconsin is an affiliate of a national organization, and we've been around the Milwaukee area, actually throughout the entire state for over 87 years.
Wow.
I like to share that because I think it speaks to our longevity and how we've been serving the community. We're best known for our advocacy and our education and our commitment to providing service to the community.
Yeah, and like you said, 87 years really says a lot.
I think so, yeah.
You've got a list of innovative programs and services that you offer to people on a daily basis. So I want to discuss some of those, starting with your Strong Families, Healthy Homes. So fill us in a little bit on what you do in that department.
Absolutely. Strong Families, Healthy Homes has been around for over 10 years. It's a program that is dedicated to providing support to parents living with mental illness.
Okay.
And so oftentimes we focus on children and we forget about the larger family context. And so our program looks at supporting parents who are living with a mental illness themselves so that we can help keep families intact and avoid any disruption to the family unit. So placing children placing children out of home care.
Gotcha.
So we try to avoid that by shoring up mom and dad's mental health coping strategies, etc.
Okay, and you've got a prenatal home visitation program that actually assists pregnant Milwaukee County residents, and we always talk about the importance when you're dealing with prenatal care, and so this is dealing with the stress sometimes that expectant mothers could go through, especially when we look at some of the neighborhoods in Milwaukee. Statistics show that poverty and distress and things of that nature play a huge part in really how a woman's pregnancy goes.
Yep. So interestingly enough, the Strong Families, Healthy Homes model was so successful that we were able to take a look at how that could apply to pregnant women, especially in Milwaukee, where we are seeing huge poor birth outcomes.
Yeah.
And so because we know that women who are living in poverty and experiencing disparities struggle with having healthy birth outcomes. And so we have taken a very successful model and we've been able to provide support to pregnant women who either have mental health concerns and or substance abuse issues. And we've seen a huge increase in healthy birth outcomes with that program.
Well, that's good news. And you also pinpoint the fact that peer mentors are extremely important when you talk about helping people who are on the road to recovering from many different scenarios. So
some of the participants in our program who are further along in their recovery have taken a 40-hour certification course, and they have then taken a state certification class, and they have passed the state certification exam, and they provide support to individuals who might just beginning their journey of recovery. And so peers are people who have lived experience with mental illness, and they share their experiences of what's worked, what hasn't worked, and provide support in a way that a provider may not be able to.
Okay, so when you talk about recovery, meaning maybe, I've done so many interviews dealing with mental health, you may have someone who starts taking their medication and they feel fine, and then they stop taking it, and then they kind of take some steps back. So do you have your mentors maybe explaining why it's important to continue to take that medication and things of that nature?
Sure, medication is always a piece of the puzzle. But I think peers offer a perspective that is a little bit different, that talks about the relationships and the connections, that sometimes that kind of support is just as important as perhaps a medication regimen.
Yeah, okay, that's good stuff. And suicide remains a significant public health program, or problem, I should say, in Wisconsin. And so what is it you guys do when it comes to suicide prevention?
Yes, so Suicide Prevention for Mental Health America is a statewide initiative, and we offer support to over half the counties in the state of Wisconsin. We receive a state grant for prevention and early intervention, and we have a coalition called Prevent Suicide Wisconsin, and that is looking at the communities individually, what is already in place, what's going well, and or who else might need to be at the table, and bringing the entire community together to talk about the best way to provide support around suicide prevention. And that can look very, very different, as it does in more than 36 counties in the state. Wow. And so suicide prevention continues to be a public health problem, just as you mentioned. We had over 800 suicides in the state of Wisconsin last year. And so we are looking at how to support communities in a very radical goal of zero suicides, which is it's a philosophy about improving quality assurance in healthcare systems, and looking at how can we, from the top down, or in some cases from the bottom up, support the healthcare system in doing a better job and recognizing. So that doesn't just mean the clinicians, that also means everyone who has contact with individuals, and supporting them and finding out what they need even when they're not receiving care. And so the goal for Wisconsin is zero suicides.
All right, and there's this Netflix series called 13 Reasons that has captured a lot of attention, and you have some people who are saying this is sending a really bad message out to young people in particular because it's so popular, but then you have the producers of the show who are saying no, but this is opening up the gates for people to feel free or not uncomfortable when it comes to talking about things like suicide. So with you guys dealing with advocacy and things of that nature, I'm guessing that you have a stance on this particular show and what it is really putting out there when it comes to messaging.
And so I think messaging is kind of the key word here, and what's our responsibility in messaging. And so the intent behind the program in terms of increasing conversation about suicide prevention, I applaud. What some of the advocates in the state are concerned about is the messaging for not only young people, but for the people that support them, schools and parents alike, understanding that how to talk to youth about suicide prevention. And some of the messaging in the program wasn't necessarily best practice, especially when we worry about youth copying or cluster suicides. And also we had hoped that the network would have been a little bit more proactive by putting a suicide prevention number before and or after the program if someone were to be in crisis. So there were some details that could have made it a little bit more responsible, that would have shown more responsibility.
Makes a lot of sense. And I want you to kind of explain why it's so important for people to be okay with talking about mental health, because so many times you see maybe certain characteristics in a person that's in your family or whatever the case, and a lot of times it's kind of just swept under the rug or not talked about. Everybody knows, but it's not talked about. It shouldn't be taboo. It has to be talked about more, which is why we have a Mental Health Awareness Month, right?
It is. And you know, that's a tricky question, in that awareness is important and education, but what research is showing us is that education alone often increases stigma. And when we pair opportunities for learning more, it's important to also pair that with exposing the broader community with lived experience. So someone who's living with this illness, who is in recovery, who is working, who has a family, who is doing well. And doing well looks different for everyone, but helping people to understand that there are people just like you and I, maybe our next door neighbors, who might be living with a mental illness. And so the only way that we can start to shift the conversation a little bit is by talking about it, but it's also by recognizing that it's not them, it's all of us.
And mental health conditions are common and very treatable. So that's an important message as well. There are screenings for depression, anxiety, bipolar disorder, PTSD, a long list of conditions that people live with on a daily basis. So taking a mental health screening is one of the quickest and easiest ways to help pinpoint a mental health condition. And as I've said, the purpose of the conversation today is to emphasize the fact that no one really needs to feel embarrassed or alone in dealing with any of these things. So I guess when we talk about being screened, when should a person maybe go get screened for a mental health condition?
Well, ideally, I wish that every time someone went to see their doctor for a physical or for a cold, that the doctor would do an informal screening right there in the office. That's ideal. Prevention. I wish we would do screenings with younger children. We do lots of developmental screenings. What would be really, really ideal is to see us starting to integrate that into early education environments. So screening is really important. Sometimes people have concerns about themselves or other loved ones, and it'd be great if they would go into their doctor, but some people aren't. And there's online screenings. And our website, www.mhawisconsin.org, has online screenings that if people want to do that in the privacy of their own home, and then if there is something that's kind of a red flag comes up, then they could seek professional
All right,
help.
The internet helps out again, right?
It does.
It really does make a difference when someone doesn't have to feel that type of pressure if that is something that they're feeling. But in honor of Mental Health Month, Mental Health America of Wisconsin, along with NAMI Greater Milwaukee and MATC Multicultural and Men of Color Initiative, together you're hosting a viewing of a very special documentary. Tell us more about that.
Healing Voices is a extraordinary documentary from the perspective of three people with lived experience with schizophrenia. And what's interesting about the documentary, it takes a look and explores alternate treatments. So certainly alternate treatments aside from the typical medications that we often think of for treatment for schizophrenia, but more importantly, how peer support was a huge, huge piece in all three of the people in this documentary and their recovery. So it's an opportunity for the community to come together and hear more about the illness itself, but also about alternate treatments that have been very successful for other people.
All right, and we'll put all that information up on the screen right now. And again, the documentary is Healing Voices, and it's going to be shown on Thursday, May 25th at MATC, the downtown campus, from 6 until 8:30 p.m. So not only is there a viewing, you also have a panel discussion as well. Yeah. So really a lot of good people coming together to help make a difference.
Yes.
All right, that's what it's all about. So Martina, anything else you want to tell our viewers as we wrap up?
No, I just appreciate the opportunity, and May is Mental Health Month, but I encourage people to take care of their mental health all throughout the year,
absolutely,
not just in May.
Absolutely. Thank you so much for being here. Martina Gollin-Graves is the president and CEO of Mental Health America of Wisconsin. For more information on anything that we've discussed today, you can visit mhawisconsin.org or call 414-276-3122. When we return to Our Issues Milwaukee, we'll continue our focus on Mental Health Month and find out more about the Milwaukee County Behavioral Health Division and the programs and services they offer to help children and their families. We'll do that right after this.